Hey, I'm Dr. Sumi again, and I'm here to talk to you about whether you should go to urgent care or to the ER. I think this question can really be boiled down to how serious are your symptoms, but there's some nuance there and I want to talk about it here today. When someone is sick or injured, it's hard to figure things out. You're under pressure and it's oftentimes difficult to Google exactly what's going on and try to figure it out. So I wanted to summarize some stuff here today to hopefully make the decision easier for you when the time comes to get medical attention. Urgent care are for problems that are obviously not life-threatening. I often tell my patients that urgent care are good for problems that you can see with your eyes. You've got a cut, a broken bone, a rash. Things like this are part and parcel for urgent care and they should be able to handle it without a problem. Things like a bloody nose, or even if you want a simple test done like a strep swab or a COVID swab, things that need minor intervention, they should also be able to take care of that too. And ER obviously are for more serious problems and things that need emergent intervention. Common things being having pain, trouble breathing, can't stop vomiting. These are reasons that people come into the ER and this is just not appropriate for urgent care to take care of. They can't generally do tests at urgent care and they can't generally do IV medications like we can in the ER. If you're having symptoms, I would often think, can this wait a day? Could I be okay if this went on for another whole day? And if the answer is obviously no, you need to come to the ER. There's obviously a lot of gray area when it comes to these complaints about going to the ER versus the urgent care. With abdominal pain, if it's food related or if you're able to keep down medicine or if you're not having any pain, you might be okay with just an urgent care to get some better treatment. But anything serious, anything more significant than that, you have to come to the ER, and oftentimes urgent cares will refer patients to the ER if they feel that something serious is going on. A maybe controversial one is fever, and in my opinion, I think most cases of fever can be evaluated by the urgent care. This is generally something that can be figured out with a good history and a good exam. If you're a very small child, or if you're elderly or immune compromised, of course it's a different story and you need to come to the ER. But I think for your general public, if you have a fever, an urgent care should be able to help take care of you. Finally, I want to talk about back pain because back pain can be muscular, but it could be something serious in certain cases. And if your pain is pretty mild or it's specifically mechanical related to lifting or you get better with a little rest, I think urgent care is fine just to get some additional treatment. But if you're having anything more serious than that, any significant symptoms, persistent symptoms, come to the ER to get evaluated. Again, urgent cares will often refer people to the ER if they feel that their problem is more serious than they can handle. At the end of the day, if your problem is serious and you feel like you cannot have it wait any longer, come to the ER to get that evaluated. If it's mild, if it's something where you can take over-the-counter medications and feel better, generally I think urgent care is a good first step in getting evaluated. That's all I've got time for you today. Thanks so much.